My name is Paul DeGrassi. I'm a licensed respiratory therapist for SuperCare Health, and I'm here to talk to you about maintaining and cleaning your non-invasive ventilator. So first I'd like to start with the bacteria filter, which is something we never want to get wet. So I'm going to put that back in place. And I'll start with this tubing. We're going to wash this tubing. I recommend washing it every day. Soap and water. Just run some soap and water down through it. And you're going to swish it around and then rinse it out with water thoroughly, and you can hang it over your shower door, or you can put it outside if it's convenient for you. When you're ready to wash your mask, I recommend using a damp cloth every day and just keeping it clean by wiping it down. Every other day I would probably do a deep clean, and I would remove the interface by detaching the gel. I'm going to wash these pieces, including this, in soap and water, warm water, and then let it dry afterwards. When it comes to your Velcro straps, we do want to keep those clean, but we don't necessarily want to wash those as frequently. So we can wash them in a washer dryer. I would say do it weekly. Make sure you let it air dry, of course, before you put it back on. The more you wash it, the more tendency it has to not stick as well. Put the gel back in. I'm just going to pop that in place. Alright, and connect your interface. When it comes to the device, I would recommend daily just wiping it down with only a damp cloth. You certainly don't want to use any abrasive soap or anything like Comet or any hard material to clean this, specifically this window or the screen. Most importantly, you're doing this while it's unplugged. You certainly don't want to have this plugged in and use any water on it, especially around the battery area. And often I would remove it from the bag . So maybe once a week I would take it out and I would wash it with soap and water. I would just kind of wipe it down with some soap and water around the outside. Make sure we don't get any soap and water in this area because it will damage the machine. After we're done washing it, of course we're going to dry it and make sure that, like I said before, we're not going to use any abrasive cleaners or any Comet, anything like that. So just light soap is a good idea, maybe some Dawn, something like that. And then, of course, once it's dry, we can put everything back in place, and we're ready to use it. At times, you may see an alarm on your screen, and so I'm going to show you what to do in the event that you see an alarm. Sometimes people will disconnect this, and they'll see an alarm, or they might see an alarm because there's a leak of some sort. So anytime you see an alarm, we want to make sure that it's connected, first of all, or find the leak or find the disconnection so that we can stop the machine from making noise. And then we're simply going to hit the reset button. So it tells us what our alarms are here, so we can actually look and see, oh, there's a low inspiratory pressure. That's because we got disconnected. So I'm just going to hit the reset button, and it takes me back to my main screen. If you have any questions or concerns about this device or any respiratory concerns regarding support that you need, don't hesitate to call us or visit our website at supercarehealth.com.